And
good evening, everyone. So today we are here in the Mental Health for All webinar. Leave no one behind, no health without mental health. So this is a part of the Mental Health for All webinar series, or previously we called it COVID-19 webinar series that the United PMS started since on the 7th of April 2020. So since then, this forum has been famous, like very known to people around the globe. So over to 7,000 views and many engagements. And now the United for Global Mental Health has hosted 34 mental health for all webinars with over 120 speakers from more than 40 countries. So today we are going to move for the leave no one behind, no health without mental health, like universal health coverage, why it is important, and why should we talk about it? So today we have three panelists with us. First panelist is Robert Yates. Robert Yates is a political health economist specializing in universal health coverage and progressive health finance. He's executive director of the Center for Universal Health and Chatham House, and he's also an honorary associate professor at the London School of Hygiene and Tropical Medicine, and a long-term consultant to the elders on their health program. And also we have Dr. Asma Humayun. Dr. Asma Humayun is a member of the Royal College of Psychiatrists and has 30 years of experience of integrating psychological aspects into healthcare, scaling up mental health resources, and advocating for ethical and scientific mental health in Pakistan. She has also been actively involved in development of the MHLEP guidelines by the WHO. Currently, she works as a national technical advisor and is leading a scalable, right-based digit model for mental health and psychosocial support by the Ministry of Planning, Development and Special Initiatives of the Government of Pakistan. And we have Peter Yaro. Peter is the executive director of Basic Needs Ghana, a pioneer mental health and development advocacy organization in Ghana. The organization he has worked in over the last 17 years. Peter was instrumental in leading civil society advocacy toward the passage of mental health law, approval of the legislative instrument of the mental health law, and the development of the national mental health policy and strategic plan in Ghana. He has been leading member in the rollout of the WHO Quality Rights on mental health, human rights, and recovery in Ghana. So we welcome all three panelists to this today's webinar. Welcome you all. Before moving to the questions, I would like to talk a little bit about the Global Mental Health Action Network, which is leading this webinar today. So Global Mental Health Action Network is a global joint advocacy, communications, and learning coalition comprising representatives of government, international organizations, NGOs, academic and private sectors around the globe. So in the Universal Health Coverage Working Group introduced by the Global Mental Health Action Network, now it has 72 members from across the globe, and it is working toward the implication and emphasizing the need of universal health coverage in global scale. We all know that universal health coverage means that everyone everywhere should be able to access health services they need without suffering financial hardships. But today we are faced with a big coverage gap of care and services for common mental health conditions, and in many 90%, around 90% of low and middle income countries. So now we'll move towards the questions today. So I would like to invite our first panelist, Robert Yates. Robert, so can you set the scene for us regarding where the world is with universal health coverage? And do you see any obvious entry points for mental health to be fully integrated into the universal health coverage in global scale?
Yes, thank you very much indeed, Pradeep, and greetings from Chatham House in London. Well, I think it was the case that just before the pandemic struck, that every country in the world had united behind the goal of universal health coverage yet again. For the third time at the United Nations in September 2019, all countries committed to universal health coverage at a head of state level. Head of state after head of state was standing up at the UN, committing themselves to everyone having the health services they need without suffering financial hardship. And at that meeting, recognizing that we are talking about the entire spectrum of what we call health services, that includes the public health services that should be protecting us against pandemics and also prevention and health promotion and curative services, rehabilitative services, and palliative care services as well. Literally, that benefiting everyone on the planet, no matter what their age and gender and ethnic background, and also whatever their health need may be. So we're not talking just about, say, curative elective surgery. I mean, a lot of people associate universal health coverage with hospital services. No, it's the absolute complete range of physical and mental health services, that people should be receiving. So you can see that within the definition of UHC, it really ought to be the case that everyone is receiving the full range of mental health services that they need. That was the situation going into the pandemic. And then, of course, the pandemic has come along and really battered every health system in the world, no matter what your income level. Rich countries and poorer countries alike have been hit very hard. And not surprisingly, there's been a sort of a big allocation of resources to tackling the pandemic. We can see the immense pressure it's been putting on hospital services and the need to vaccinate the entire population. But I would say that the principles of UHC remain the same. And what we've seen through the pandemic is the really enormous increased burden of mental health issues that have been sort of suffered, of all natures, all across the world. Populations being locked down and isolated, and the issues that's created around a big increase in depression, and the traumas that people have been having, even with the virus, creating major mental health problems, and this burden of disease needs to be tackled. So I would say that the case for universal health coverage is stronger now than perhaps ever before, and that worldwide populations have been demanding of their leaders that they provide a full range of health services to meet their health needs. So even though one might feel that it's been a really, really difficult 2 years, and public financing has obviously been hit very hard as well, I would say that, if anything, the pressure on heads of government and ministers of finance to ensure that everyone gets full protection and full coverage of health services is greater now than ever. And that what we're seeing now is greater pressure to accelerate universal health reforms, to put more public financing into a healthcare system. And this being a very good opportunity for those of us who are passionate about mental health services to make sure that they get a decent slice of the cake. If it is the case that you have this big increase in financing going into a health sector, it's at times potentially rising budgets, that you have opportunities to address your coverage issues. And that's very much true here in the UK. Here we've seen big pressure on the health and social care sectors, and the fact that they've been quite separate for a long time. And this government here in the UK has tried to sort of start to address that now, just with the reforms that they've introduced since September. So those countries, particularly who I think acutely feel that mental health services aren't integrated into their universal health reforms, now is the time, I would say, to get active and be campaigning for that. And then hopefully, as the public financing begins to increase, you'll see greater investment in mental health services that will benefit the entire population. Thank you.
Thank you, Robert. So now I'm moving to the Asma. The customer, as per view, like what are the major challenges for integrating mental health into the universal health coverage?
Thank you, Pradeep. It's important to set some context. So the population of Pakistan is roughly 4 times that of the UK. Our resources are scarce, very scarce, and highly inequitable, and the treatment gap is huge. So in terms of where we stand at the moment, from intention to integration of mental health into universal health coverage, we are not even on the graph yet. Mental health is not a health priority in Pakistan, and it is not likely to be so for a while. For it to have any chance of traction, it has to be pitched as a development priority. If we want to prepare ourselves for integrating mental health into universal health coverage, it's important for us to understand that it is not going to be a matter of strengthening existing mental health services. We are looking at a need to transform the services. In terms of to be able to do that, it's really important to understand the politics of mental health. In countries like Pakistan, we need to understand the existing barriers or the main challenges. So keeping the objectives of WHO action plan in mind, I'm going to briefly describe some key challenges. The first one has to do with governance. Transparency and public ownership is crucial. Mental health is too important to be left to expert committees. I think that all mental health plans, they need to be monitored for the progress or lack of it, and there should be accountability. In the same spirit, it's extremely important that we institute some regulatory mechanisms for the existing services before seeking or securing further investment. The second point that I want to make is that the mental health experts are trained as managers, and as a result, they can coordinate and they can control. Power is a core feature of managerial role. But for us to develop mental health services, we need to, these power plays don't help because we need to develop or we need to attempt to develop effective cross-sector partnerships and partnerships in the community. So we need to invest in developing mental health leaders. The third point that I want to make is about wholesale ignorance about mental health needs, and compounded by a crippling data gap. So whatever plans we make, they are not driven by evidence, and they are not designed comprehensively for any meaningful impact. So these trends for ad hocism and mediocrity, they need to be confronted. The fourth point that I want to make is about this idea of integrating, idea of providing integrated and responsive mental health services. We need to understand that our healthcare system is fragile and overburdened. And we need to support and prepare the system before expecting it to perform any additional role. So in my view, we cannot go from no integration to an integrated stage. There is a crucial middle stage, which is prepare to integrate. And for that, we have to focus on reconstructing the missing mental health links from the community to the specialist services. And the last point that I want to make is that, this over-reliance of biomedical practices and tertiary healthcare, this is not by default. This is strongly backed by the pharmaceutical industry. There are no incentives to work towards encouraging psychosocial interventions or developing community-based services. Thank you.
Thank you, Dr. Asma. Now I'm moving to Peter. Peter, I think you can hear me. My question for you is, how well is mental health being integrated into mainstream national health systems? Peter,
You might need to unmute Peter.
I think there's some kind of a technical issue with Peter. Peter, can you hear us? Okay, so until Peter gets back with us, I'll move to the second round. But before that, I have a great announcement for you that the Global Mental Health Action Network's Universal Health Coverage Working Group, United and also United for Global Mental Health, in collaboration with their partners, they launched that No Health Without Mental Health report last year. So now they are going to launch a policy brief on integrating mental health into universal health coverage using a right-based approach. So the launch date is the 13th of December. So I invite every participant to join this launch event and also follow this policy brief. And so with that note, I am moving to the next round of questions. So the first question goes to Dr. Asma. So Dr. Asma, how are you trying to overcome the challenges that you described before? So what need to be done at the national level for it to be fully integrated in the future?
I think you might need to unmute.
Sorry about that. I'll briefly describe the role of Ministry of Planning, Development and Special Initiative. They have an exclusive mandate to identify an overlooked area and help build its portfolio in collaboration with relevant stakeholders. So availing this opportunity and as part of their emergency COVID response, we were able to develop a right-based multi-layered digital mental health model for mental health care, which we think is scalable. And at the moment, we are piloting it in Islamabad. So the main infrastructure of this model is a web portal, which is integrated by a telecom solution and backed by a customized learning management system and 3 mobile applications. This integrated system has the capacity it has been designed to consolidate all information that comes in and also support the trainings, the supervision, develop a referral mechanism, and also provide services. So for that, what we did was that we created a pool of specialists and recruited fresh graduates of clinical psychology to develop a mental health workforce, which is working at 4 tiers through a task shifting approach. And each tier is supported by evidence-based resource, which has been developed for their training. So these resources have been contextualized. They have been translated into Urdu also, and they have been developed into digital tools, which are connected to the web portal. I think the main core feature of this plan is how we have tried to engage the community and develop some kind of outreach. What we've been able to do is so far registered about 800 community workers through developing intersectoral partnerships. And these mental health workers have been trained online in courses offered in English and Urdu. And then they are connected with the web portal and our mental health team through a mobile application where they can seek supervision also and they can refer patients also. In the same way, we've been able to develop a mobile application to support frontline responders and those who are at risk for developing stress-related conditions. And this application follows a hybrid approach where the user can assess and manage their stress themselves, and at the same time connect with the team whenever needed. So all throughout this process, we were very conscious that we maintained a transparent process. We were sharing information for collective learning, and we have tried building in as much feedback mechanism as we could. The users can also give feedback on the web portal about the service. Now, I think this is a critical initiative because it might be a solution for us to go forward to integrate mental health into universal health coverage. It's cost effective. During the pilot process, even if we consider half of the population of Islamabad, which is about 1 million, our cost of running the pilot is ₹1 per month per person. So in terms of a monthly expense, we've been spending about less than $6,000 a month. And I think that what is happening now is that the Ministry of Planning is exploring ways with Ministry of Health to see how they can sustain this project and maybe allocate a separate budget for it soon after the pilot is evaluated. Thank you.
Thank you, Dr. Asma. Now we have Peter back. Hi, Peter. Now I am moving towards you. So, how well is mental health being integrated into mainstream national health systems? What are your experiences?
Thank you very much, and my sincere apologies for the delay. It was a bit technical for me as well. Mental health, following global actions, has had a positive shift in Ghana, which give potential of improvement in the healthcare system, but we are not there yet. We have a Mental Health Act. We recently launched the mental health policy, and there is now an agency of the ministry solely responsible for mental health, what we call the Mental Health Authority. And by this, there is moves to decentralize mental health care in terms of responsibility, appointing regional coordinators and district level coordinators. So this is like having provincial and sub-provincial coordinators. And with these, in terms of structure and looking at the governance aspects of mental health, we would say in Ghana, things are progressing. But these are not really matched with the needed resources. And I think fellow panelists touched on that in terms of really supporting investments in mental health. The budgets for mental health is still in the less than 1% in Ghana. And even though the policy is now targeting 5% of the health budget. So it's a bit of a mixed bag where we are seeing the structures gradually emerging, but the actual investments and actualization of what is stated in policy is still a bit somewhat short and limited. If I can just present this as my preliminary comments for now.
Thank you, Peter. So now I am moving to Robert Yates. So you are an expert, and your Chatham House is working on global level to bring mental health into the universal health coverage. So what can be done to ensure mental health is prominent at the 2023 United Nations high-level meeting on United Health Coverage, which stakeholders need to be in the most active role?
Yeah, thank you very much, Pradeep. And you're absolutely right to flag that there's going to be another gathering of heads of government in September 2023, another universal health coverage high-level meeting. And I'm sure people are going to be sort of taking stock of what's happened after the pandemic and which way now for universal health coverage. And there, it's absolutely going to be vital that, that we are looking at a completely universal and comprehensive, response to health needs moving forward. We do have a terrible tendency in global health world to sort of lurch from one thing to another, that, that we, around the MDGs, that, the focus was very much on infectious diseases and maternal child health. And don't get me wrong, those are hugely important things. But then you could see there was very much a feeling, oh, well, we haven't seen enough spent on non-communicable diseases now, so we must sort of focus on non-communicable diseases. And now COVID's come along, and all the attention is being paid to pandemics and preparedness, and there's sort of a general view that we should sort of refocus on those areas. And I think that this isn't good for the global health community to appear so fragmented and so disjointed and doing, concentrating on one thing for a couple of years and then switching to something else. Because at the end of the day, if we're serious about universal health coverage, it's all about, having this top of the agenda of the head of government and the Ministry of Finance. And so I think the beauty of universal health coverage is it is an issue and almost like a brand that politicians like and they understand it. I think sometimes there has been a mistake for us to get over technical, to use too much sort of technical language. Even dare I say it about some of the, the things that we love dearly, things like health system strengthening, primary health care. They are rather ill-defined, and heads of government don't really understand them, and therefore I think are less inclined to get enthusiastic about them. The great thing about universal health coverage is it's basically about everyone getting health services and the government paying for them. It's something that populations the world over take to the streets to demand and demonstrate for. I've done it here in the UK in protecting our NHS, and I've seen plenty of marches from the United States right through sub-Saharan Africa and South Asia as well. It's something that populations get and understand, and therefore it's something that heads of government get and understand as well. That we should have everyone having all the health services they need. So I think the most important thing around the high-level meetings is to present a unified front to heads of government and to ministries of finance to remind them that the world is demanding universal health coverage from them. In fact, at the beginning of last year, the United Nations, had a big survey. I think there were over 1.5 million people worldwide who were surveyed to say, what would you like to see your government doing more of? Where would you see the priorities for your government? And universal health coverage and access to health services came top by miles. I mean, you might say that's inevitable because of the health crisis. But I mean, dare I say it, let's not waste this health crisis. We have got the attention of heads of government and ministers of finance. So I think it is a case of, united we stand and divided we fall when it comes to this. And I think, for the mental health community to line up with other areas that tend to get neglected, I would say palliative care services often gets neglected, sort of care of the elderly, care of the disabled often gets neglected as well. But if we present this united front, then we can see these step changes of investment in health. But then it's very, very important that we ensure that those resources are allocated efficiently and fairly. And that has to mean a bigger share of resources going for mental health services. So I'm not saying that there shouldn't be separate advocacy and campaigning around mental health services. I think there should be, because history has shown that there is competition with it within the health sector, and there's a danger that the hospital sector will run off with all the money. Much better, I think, that we present the united front, but that we also very much use the evidence around the burden of disease, what people want, and really sort of use political champions and advocates to remind governments, that how important mental health services are. And I think we've seen some really great examples of that around the world in recent years. I mean, not least here in the United Kingdom, where I'd say that a lot of the focus on mental health services in the last 2 or 3 years has really been around Prince William and Prince Harry making this a big priority. And, in the UK, the royal family are, sort of very, very important in terms of influencing public opinion. So I think it's a sort of be a mixture really at the high level meeting to be presenting the technical evidence, but also thinking politically as well about who are the champions, who are the influencers. But it's very important that this is done within the UHC tent, because if all the different subsectors, sort of go to that meeting and are seen to be fighting amongst each other, then I think the danger is that ministers of finance and heads of government will say, well, this lot don't know what they're doing, and we're not going to take UHC seriously. So that would be my plea, to do it within the UHC movement, but also be conscious that there is going to be a need to fight for a bigger share of resources to go to mental health services.
Thank you, Robert. So now I'm moving to Peter. So this is the last question of the 2 rounds. So Peter, so what are some of the immediate steps that civil society organizations and networks like Global Mental Health Action Networks, Universal Health Coverage Working Group should take in the build-up to 2023 UN high-level meeting? Peter, you are muted.
Thank you very much. Just as Bob just mentioned, we need to rally our ranks. As civil society, there is strength in numbers. And when we have the numbers, the ministers of finance and ministers of health listen to us. And I think building coalitions that have service user representation actively engaged in articulating the issues very key. To use Ghana as an example, we have the Mental Health Alliance, but we also have a strong service users group, people with lived experience and caregivers. And we are now approaching celebrities to consider joining these, because a few have come forward to talk about their mental health situation. And so civil society, just as the Universal Health Coverage Alliance and the SDG group and many others across the globe, particularly the Global Mental Health Action Network and sister networks, are all rallying points to strengthen our ranks, to engage and to articulate the need for investments in mental health, making sure that inclusion is key. So taking advantage, as Rob said, of this crisis, it's one of the strengths that we should build on, to say we need to begin to strengthen the health systems, because we cannot think of anything else, because that would be at our disadvantage if we still want to bury our heads in the sand that nothing is happening. And this is where civil society can raise that consciousness and lead the process of articulating these issues.
Thank you, Peter. Now we are moving to the questions from the participants. So I have plenty of questions. Before that, I would like to remind you again that the Global Mental Health Action Network and United for Global Mental Health, with its partners, they are launching this policy brief on integrating mental health into universal health coverage using a rights-based approach on this 13th of December. So we would like to invite all of you to join in. So now I am moving towards the questions. The first question is to Dr. Asma. Dr. Asma, why does World Health Organization is propagating integration of mental health in primary health care, when, as you say, the primary health care or health systems of many low and middle income countries like Pakistan is so ineffective and poor? Pakistan does not have a viable public funded public health system. So what's your answer?
This is a very good question. I think the challenges stem from the fact that we don't have a viable public health system. We have the choices that we do nothing and wait for the system to strengthen up and then see if we can do mental health integration or not, or we start working to strengthen the mental health services Like I said, there is a gap between the community and the specialist services. And we need to, just like there is a general health care system, there should be a public mental health system also. And I think that both efforts can go hand in hand, and mental health should not wait for the general health care services to become viable before we start integrating them. Thank you.
Okay, the next question goes to Rob Yates. So, Rob, is it realistic to ask for mental health services as part of United Health coverage given already limited finances being available?
Oh, yes, absolutely. Really, because there are so many very strong health, economic and political reasons why you should do so. Sort of mental health, so just the sheer burden of disease is enormous and getting higher. So if you're serious about, go back to the definition of universal health care, which is all about health services allocated according to need. And that should be really driven by the burden of disease. So it's absolutely the case that there's such a huge burden of unmet need for mental health services, that there's a very good health reason, and there are very effective services that can make that, meet that need and improve people's health outcomes. Then you have all the economic benefits as well, that a lot of the services we're talking about are very cost effective, particularly when provided through a primary healthcare setting. So in many respects, dotting back to the first question, one can be sort of almost building your effective primary healthcare system with mental health services right in there from the outset, and sort of demonstrating that mental health services are actually a very viable and cost-effective way of providing primary healthcare services. So, this can really encourage the population that they'll get good quality, accessible health services near where they live without having to go to hospitals. So it could be a very good model for demonstrating why primary healthcare services are a good idea, and therefore there should be even more investment put in. But as well, I think there's the political reasons as well. Sort of people, sort of coming through the pandemic, have been really hit very hard by this. Their mental health has been hit very hard. They're looking for their politicians to improve their lives. And dare I say it, that improving the health and well-being, particularly the mental well-being of populations, will make people happier and more optimistic, and potentially more likely to vote for the politicians who have brought them these services. So I'd say on those three major arguments, health, economic, and political, there are very good reasons why government should be investing in primary health care, provided mental health services coming out of the pandemic. And that means at all income levels, here in the UK and in wealthy countries, right through to some of the poorest countries in the world. You can do this. What it requires is political commitment and public financing.
Thank you, Rob. So now I am moving again towards Dr. Asma. Dr. Asma, how much buy-in is there from the wider psychiatric community in Pakistan for the system that the Ministry of Planning have developed? What are the challenges are facing in getting it accepted by wider psychiatric community in Pakistan?
There are many challenges. And the challenges basically stem from the fact that the psychiatrists are used to working in silos within their tertiary care setups. This approach to public mental health care is not so common. Also, there is a lot of territorial responses if they feel that they are not part of the plan that is developing. The Ministry of Planning works in collaboration with relevant stakeholders. The first step was to develop a model. The second step would be to make partnerships and disseminate the information so that people can align themselves with the plan and see how they would like to contribute. There are two ways of engaging mental health professionals. I'm not going to restrict to psychiatrists alone. I think we have to consider mental health professionals, and they come from diverse backgrounds and they have different understanding of what needs to be done. So it's really important to bring all mental health professionals to the table, and either you can make alliances by educating them and by forming collaborative networks, Or I think the second way would be that if the government takes stock and formulates a program that could be implemented, then everybody will align themselves to that plan. Thank you.
Thank you, Dr. Asma. Now I am moving to Peter. Peter, this question is, what is the importance of taking a right-based approach to mental health as a part of universal health coverage?
Thank you. Taking a rights-based approach means you carry everyone along. And I think the recent call or slogan that leave no one behind is very appropriate because it is rights-based in the sense that you don't allow those who are less privileged, the more vulnerable, to fall through the cracks. Rather, from a rights point of view, you would have to go and pull along all those who have been left out because of either their mental health condition, their socioeconomic situation that does not give them access to participate and feel that they are part of the system. It's also one where services are not developed for the rich and those who can afford, very high class, sophisticated, but also the very basic services that should be available at the community level to promote health, to prevent ill health, to support rehabilitation and encourage whatever care that is needed for people who are in chronic palliative conditions. And that is where everybody would have been catered for in the health system. When we remain at highly expensive curative interventions, then we leave those who are at the community who just need education to live an improved life. And that's why healthcare services, mental health care services should be from a right point of view. And just to end, when you have a broader participation, then you see inclusion and you see that there is maximization of resources and costs could come down. Thank you.
Thank you, Peter. Now I'm again moving to Rob. Rob, would it be correct to say some mental health should be seen as cross-cutting component of universal health coverage rather than a separate disease type?
I'm sorry, could you sort of repeat the question again for me, please?
Yeah, would it be correct to say mental health should be seen as a cross-cutting component of universal health coverage rather than a separate disease type?
Yeah, yes, I would say so. And in fact, I think what we're recognizing more and more is just that there are so many determinants of health and healthy well-being. If you think back to the SDG, you know, which is all about healthy lives and well-being for all at all ages, one can see that there are so many interrelationships, both within what we regard as the health sector, but also getting more into these social determinants of health. And, you know, we see so much around health and well-being and health societies being around things like, you know, what I would say sort of cross-cutting things around sort of climate justice and public spaces and safe streets and decent diets and the interrelationships that all those things have on both people's mental health situation, but also their physical health too. So I think more and more, if we approach health in a holistic way and you know, sort of recognize, as I said, you know, I think the COVID pandemic is almost a perfect case study of this, is that what has appeared to be, you know, sort of what has been a major infectious diseases event has had massive knock-on, you know, sort of effects on NCD services and you know, cancer waiting lists and in particular a mental health burden. And the way to sort of get over this, I think, it isn't to slice things up into, you know, lots of different services and pretend that these things should be sort of treated individually, but should be done much more holistically, and that both within reforming health sectors, so there's a greater emphasis on primary health care, people getting a full range of services that address their physical and mental health needs at the same time, but also that address some of the maybe sort of social determinant issues as well about, you know, people accessing benefits, are the streets safe and clean, you know, which you can say is like health in all policies, and means that, you know, we should be getting involved in transport policy and taxation levels and things like that. So I would say that mental health services, you know, really glues it all together, really, you know, sort of goes from what we regard as traditional health services well into the social determinants of health. And we're much better to sort of tackle these things in a holistic way rather than the tendency that we've done in the past. And I think, dare I say, a lot of this has been fueled by sort of aid financing that's been very projectized, you know, that, you know, we will do a project on this particular disease and nothing else. And I think, you know, that's a big mistake, and you know, that we should move away from that. And in many respects, therefore, that I think UHC reforms, because there's greater emphasis really on them being domestically financed, you know, sort of by governments themselves, I think again provides a great opportunity to tackle these health issues in a more comprehensive and holistic way.
Okay. Okay, Rob. So I have 3 more questions to be answered in like 3 minutes. So now I'm moving to Dr. Asma. Dr. Asma, do you think that integration means that we move away from institutionalization? Do you think that integration is like we move away from institutionalization?
Well, integration should be seen as part of developing the mental health services holistically. Institutionalization, I think, refers more to the long stay kind of mental hospitals. I'll focus on the tertiary care systems. I think there is going to be an extremely important position of tertiary care services. They need to redefine their role. At the moment, most of the tertiary care services are being provided as if they are the primary care mental health services. So people can just walk into, and you need to go to an outpatients department to see that in a tertiary care specialist hospital, there are 100 or 200 patients waiting to be seen every day. So that needs to change. The specialists working at tertiary care centers need to redefine their role, because they need to contribute better in training and supervising the multi-tiers, right from the primary care to the secondary care. So I think only the very difficult, resistant, severe mental disorders should be referred to the tertiary care, where they should be managed. So their role is going to be vital. Thank you.
Okay, the next question is go to Rob. Rob, are there any key global movements in 2022 that universal health coverage and mental health advocates should look out for?
Yes, there certainly are. And I think the important thing is to both look at the global level and the country level as well. I mean, I think that, you know, we are, you know, in the global health community, often very interested in these big global debates about universal health coverage and what's happening at the World Health Assembly, and you know, you have events like the World Bank annual meetings, the IMF meetings. You know, there's a special WHA this week about the sort of pandemic treaty, and it'd be interesting to see if the words mental health appear in that at all. So, you know, that would very much be something to be focusing on. I would say, you know, it is important that we look at the global debate and make sure that, you know, that things are given sort of proper attention, you know, particularly to mental health services. But if anything, I think equal, if not more, attention should be made to the debates happening at a country level, because at the end of the day, people getting health services, people being covered by health services is primarily a decision made by governments, national governments, state governments. And I think the excellent panel that you've assembled, you know, you've got 2 fascinating countries that are embarking on their UHC journeys at the moment, you know, sort of that's In Ghana, they have the National Health Insurance Program, I think covering about 40% of the population, and big debates about what is added to the benefit package. I think I've seen recently that pediatric oncology services being added, family planning services are being added to the benefit package in Nigeria. I don't know the extent to which mental health services are included in that benefit package in Ghana. Absolutely critical that they are, if that is going to be the vehicle to achieve universal health coverage in Ghana. Likewise, in Pakistan, that the Prime Minister has announced, coming out of COVID-19, he wants to launch a welfare state in Pakistan, I think focusing on food security and a universal health system. And, you know, he's entitling households to universal health coverage. My understanding is the benefit package is skewed very much towards inpatient hospital services at the moment. The card that you get given entitles you to a certain amount of health financing at a hospital level. Now, I would say that'd be very, very important that that benefit package is extended to primary care services and mental health services too. The decision as to whether that happens or not will be very much up to the government of Pakistan, but the whole political process, you know, will pressure be applied to the government to do the right thing there? So I think that as much attention should be made to these decisions, particularly in low middle income countries, and especially around the time of elections. You know, these things are very, very politicized. And, you know, if you have a situation, say, of a head of government not prioritizing mental health services, and, you know, that being very unfortunate, you know, have the discussion with opposition politicians and say, you know, that why don't you make it part of your election platform to extend the benefits to include mental health services as well? These things are highly political. They are across the world. And I think we should be embracing the politics and the competition amongst politicians to provide better and more health services to their populations. So very much encourage mental health campaigners across the world to make sure you're talking to all political parties and, you know, give your votes to maybe the ones that sort of cover mental health services the best.
Thank you, Rob. So I have another round to go, but before that, Peter, if you can add and 1 minute answer to how can universal health coverage help reduce abusive treatment practices like shackling and chaining, those kind of.
Thank you very much. I'd like to pick up from where Rob ended. Universal health coverage can reduce abusive practices such as chaining and shackling when services are widely available at the community level and either paid for or subsidized, such as under the National Health Insurance Scheme. One of the reasons from my work experience, not any scientific study done, but from my work experience is the notion that going through the traditional healers and the rest and more or less giving up on how they treat your relative is partly because people feel that going to the hospital is expensive and they don't have the money to pay for it or the means to meet the cost of the treatment. So if there is assurance that mental health care services are funded under NHIS, you would see a substantial reduction in people going to patronize services of traditional healers where some of these abuses take place because they have assurance of no payment. There are the cultural aspects to it that can be dealt with through continuous education, awareness creation that is taking place, particularly by civil society organizations like Basic Needs and the rest. So including mental health into the benefits package, it's one. And again, as my other colleague mentioned, ensuring that decentralization is not one where people go to the tertiary facilities, but go to the community facilities, and tertiary places are just referral. And that again can be realized when cost of healthcare, mental health care services are subsidized and people feel comfortable to go for. And you can't take away continuous awareness creation and education to families, to service users, and making service users be able to take control of their healthcare. And that's where the WHO Quality Rights Initiative comes in handy. And this has been rolled out in Ghana, where people with lived experiences and healthcare service providers are exposed to quality rights to treat people from a right point of view, as you earlier on mentioned, to know that advanced planning for people, recovery-oriented approach to management of mental health conditions is far better than trying to force treatment or do extrajudicial practices. Thank you.
Thank you. Yeah, thank you, Peter. So now we have passed the time, but we know that universal health coverage and mental health is an endless debate. So, and also we have a lot to talk about and a lot of questions coming in, but still now we have run out of time. So I'm going to go to a quick run around three of you. So could you please give us a 1 or 2 sentence message to take away, kind of a takeaway message from your summary or something like that? First, I'll move to Rob.
Thank you very much, and I've really enjoyed the discussions today. I'd like to perhaps finish on an optimistic note, really, that whereas there might be a feeling that sort of given the pressures that there are on governments and on public financing not to launch universal health reforms at the moment, talk about it being too expensive and you can't do it in times like this. If you look through history, so many of the world's great universal health systems have come out of crises, just at the time that politicians are under greatest pressure is when they tend to launch universal health reforms. That happened in the UK, France, and Japan after the Second World War. It happened in Sri Lanka after malaria epidemics in the 1930s and 40s, in New Zealand after the Great Depression, in Thailand after the Asian financial crisis, in Rwanda after the genocide, and even China re-socialized its health financing system after the SARS epidemic. So, it really is the case that looking at that history, now is the time to be promoting UHC to your political leaders. And we're already seeing some countries, countries like South Africa and Pakistan and Ireland even, which hasn't got a publicly financed universal system at the moment, really thinking now is the time that they should do this. And I think it even might happen in the United States too. So I think this is the opportunity for the global health community to come together and double down on our efforts to reach UHC, but making sure right from the outset that mental health services get the coverage that people need.
Okay, thank you, Rob. So Dr. Asma, message?
So my message is that mental health must be integrated into universal health coverage for, I think this is going to be the key for national prosperity, national well-being, and sustainable growth.
Okay, Peter, so just few seconds, please.
Well, I'll just say, in addition to all the excellent comments made by fellow panelists, to say that we would want to see mental health that is inclusive, that is rights-based, that really takes the view of people's lived experience into consideration. And by that, we are sure to get a healthcare system that really responds to the needs of the most vulnerable and the most in need.
Okay, thank you everyone. Thank you all the panelists for joining today. So it was a great discussion, and as we talked before, like this is an endless discussion and we have a lot to do, a lot to talk about, and a lot of questions coming in. So, but we have to wind up here. But before that, I would like to remind you that the next Mental Health for All webinar will be held on the 14th of December, discussing mental health advocacy in digital world. It will recap the learnings from 2021 and also we'll talk about the plans for mental health advocacy in 2022. So thank you all the panelists for joining today, and thank you all the participants.
And see you all again on the 14th of December at the next Mental Health for All webinar. Thank you all. Good night.
Thanks all. Right.